Alright guys, next question. A nurse's identification badge includes the term psychiatric mental health nurse. A patient with a history of paranoia asks, what does the title mean? The nurse responds best by answering with which of the following. A. Don't be afraid. It means I'm here to help, not hurt you. B. Psychiatric mental health nurses care for people with mental illnesses. C. We have the specialized skills needed to care for people with mental illness. D. The nurses who work in mental health facilities have that title. The answer is C. We have the specialized skills needed to care for people with mental illness. A psychiatric nurse has specialized nursing skills and implements the nursing process to manage and deliver nursing care to mentally ill people. Alrighty, next question. Which statement about diagnosis of a mental disorder is true? A. The symptoms of each disorder are common among all cultures. B. Culture may cause variations in symptoms for each clinical disorder. C. All mental disorders listed in the DSM-5 are seen in all cultures. D. Psychiatric diagnoses are listed separately from other psychiatric disorders in a 5-axis system. The answer is B. Culture may cause variation in symptoms for each clinical disorder. It's important to keep in mind, guys, that every society has its own views of health and illness and the types of behaviors categorized as mental illness. Culture also influences the symptoms of a particular disorder. For example, individuals of certain cultures are most likely to express depression through somatic symptoms than through effects and feeling tone. The 5-axis system was abandoned in the addition of the DSM-5. Alrighty, on to the next question. The prevalence rate for major depression disorder over a 12-month period is which of the following? A. Lower than the prevalence rate for panic disorder. B. Greater than the prevalence rate for suicidal behavior. C. Equal to the prevalence rate for schizophrenia. D. Greater than the prevalence rate for generalized anxiety. Alrighty. So the answer here is D. Greater than the prevalence rate for generalized anxiety. The prevalence rate over a 12-month period is 4.1% to 4.6% for major depressive disorders, and 0.7% for panic disorder, 11.5% for suicidal behavior, 1% for schizophrenia, and 1.1% for generalized anxiety. Okay, on to the next video.